works, you guys. It wouldn't let me put my orientation. Okay, so as you guys pop on here, I'm standing in front of the Regional Center for Border Health. It is a main NGO here in Yuma, in the Yuma sector. Didn't really think I was going to find anything, but surely did. So these huge charter buses here, and I have to be over here because this is private property. They just kicked me out, but luckily I know my rights as a journalist and I can be on sidewalks. Ah. So there, 2 buses, 1, 2, and I just watched, 100 people come off of one of them. This one just arrived. I asked one of the women working here where they're coming from, and she confirmed that they are coming from border processing facilities. So after they were, at the border wall, after they cross, and then they go into border protection, custody and processing, then they'll come here to the NGO. So they showed up with their bags, with their suitcases, in kind of like a bag covering, being processed, but being held and talked to in these tents. They have kind of a loudspeaker, and they're talking about the protocols and things like that here. So again, 2 buses, charter buses, these huge white ones here, come across. I gotta be respectful because it is private property. So that's the charter bus. That's the one that just showed up. So 2 of these within the last 10 minutes that just showed up here. So this is this is Family Behavioral Integrated Services, but this is the center basically for border health. So this is interesting too. They've got a COVID vaccine and testing and flu shot drive-through for kids and adults. At the NGOs, we know if there is going to be any testing or anything like that, it's going to happen within the NGOs. They're not doing it within border protections. That kind of falls on the shoulders of NGOs who are helping. Again, a lot of people get frustrated that the NGOs are helping, things like that. This is a humanitarian crisis in this world. And I think it's important to look at the perspective of if there's a homeless situation or crisis and a shelter steps in and helps and feeds people, they're not just going to let people die. So that's the thing. The funding and things like that. When I talked with Catholic Charities in McAllen, in the Rio Grande Valley, they said that they know that there is funding available, but that they were not using any government funding, that they were using community and fundraising funds and stuff like that. So, they asked me if I'm taking pictures and stuff like that and tried to kick me off the property, and he said, I need you to leave, and I said, well, actually I'm just going to go stand on that sidewalk. And he looked at me, I go, I know my rights as a journalist, and I know what's legal and what's public property. And then he goes, you're right. So we still here, but again, not sensationalizing the situation, but I do want to show you, this is where some of the folks have gone that were crossing illegally in from the Mexico side into Yuma. So they have been processed by Border Patrol. At this point, we have that confirmed from one of the workers here. I asked, are they coming from Border Patrol? And she said yes. Now the thing is, they all had paperwork, they all had their bags wrapped up in a case, kind of a carrying area. So they are coming from one place that has been processed. That is very important. So again, this is one of the NGO here in the Yuma sector, and clearly pretty busy. When I went in there were about 50 people already sitting in the tent. The bus was being offloaded, and then this bus was arriving. So we certainly have a couple hundred people that are going to be within this NGO, and then the NGO is going to help them. If they need clean clothing, they are a charitable, non-government organization. So if they need food, things like that, that is where they're going to get a little bit of assistance. And then from there, a lot of times the NGOs will give them their documentation that shows exactly how they need to go to where they're going. One family I just talked to was going to Georgia. They will have. When I asked, I said, where are you going? They said, United States. I said, but there are 50, so where are you going? And they didn't know, and I was like, and I started naming states, and they were like, oh, one Uzbekistan man was going to Philadelphia, was going to Pennsylvania. And then the other guys, the other 3 Uzbekistan single male that were there as well were going to New York. So, the NGO will help them either get their plane tickets in order. You see them with those sheets of paper that say, help me, I don't speak English. Please help me, get to where I need to go. So that is a very real situation that happens at these NGOs, because again, they aren't just going to turn them out into the interior of our country. They have been processed at this point. The NGO's not processing them, y'all. The NGO is helping them get to their next steps because they're not just going to turn them. I'm not defending any situation or picking a side, but the reality is this. If the NGO doesn't step in to help them, they don't speak a lick of English, they get turned out by Border Patrol and then go where? Walk around aimlessly, I suppose. So the NGO is helping them get to where they're supposed to be going. But when I talked to the Uzbekistan group, none of them had family in the States at all. So, but they were all single adult male, and being from Uzbekistan is it is a special interest country. So it was interesting. They showed us their passports and everything, and one man spoke English, so and hear how the special interest cases are handled. That would be really interesting. Okay, so again, if you're just tuning in and watching, we are here at the NGO in Yuma. This is the NGO in this sector. This is the resource for border health, the Center for Border Health here, the Family Behavioral Integrated Services. So saw a lot of people come off of the bus. This guy's going to try and kick me off this property. I just know. So we'll see what he does. And if he does, I'll just go across the street. That's the other option, you know. It's all good. So we'll see. Hi. How are you doing today?
Good, how are you?
Doing well, thank you. I am.
If you want, I can talk to you on the public relations.
Sure, that's fine. Hi, I'm Allie.
Not on camera though. Let's
Okay.
Just, yeah.
Okay, let me end. I'm live streaming.
Oh,
so
okay, sorry about
I do
that.
everything live.
Okay.
Are you sure? I mean, I do things live so things aren't taken out of context.
Uh-huh.
And so that things are exactly as they are.
No, I just wanted to talk to you and see what you wanted, what you were doing your story on.
Oh,
that kind of thing.
so I'm an independent journalist. I've been covering the border crisis now since August. I've been walking with the migrant caravans I was down there for over 100 miles in Chiapas for 15 days. So I'm very invested in this situation, and I know it is a humanitarian crisis, and I know absolutely that you guys have a role here, that you can't just let people die, and you can't just turn people out into the country with no direction. And I just explained that to my followers and explained, you know, some people get frustrated at the NGO saying you guys are helping and enabling and all this. And I said, well, you have to understand, in a homeless crisis or anything, a charitable organization is going to step in because we're human beings. And you also, everybody I've talked to has no idea, they don't speak a lick of English, so they have no idea where they're going. So once they're processed by Border Patrol, kicked out, where are they going to go? You guys are helping them to go legally to where they've been told to go. And I explained that. So that's the MO, right? I'm not here to go, they're helping them, look at these buses of people. I'm not a sensation. My thing, I'm an objective journalist. I am a real journalist still, Alex. So I am one of those people that's just showing what's happening, the reality, and showing, you know what? These people are going to go from the border wall, which is what I've been on for the last 2 days. They're going to be processed by Border Patrol. This NGO is going to help provide them if they need clean clothes, if they need something to eat, if they need help planning their next step, whether it's a bus ticket to Georgia or wherever they're going, because they know where they're going already, because Border Patrol has lined that up for them. So it's not you guys.
If you wanna ask me questions, I'd be happy to answer them. We can let's go in the shade though. Yeah,
that would be wonderful. I just, you know, I'm not.
I just wanted to get an idea for my staff protection and for the people's protection.
I get it. I'm not a dummy. I get it. It's hard. It's hard. It is.
Kind of banned all media and I will. I'll answer your question.
Okay, but again, like that, I don't have an agenda. Don't have that. That thing does not exist for me, because I think that it sucks that we have taken away the opportunity for people to make up their own minds. So I actually left my job as a news anchor for 12 years to go independent and not make money. I don't get paid, so I'm doing this on my own because I think it's an important issue that impacts us all. And it's a bad situation for these people because it's a lose-lose.
Absolutely.
Right? Then they get into our country and everybody hates them. They left a country that they didn't want them, and then they're going to a country that doesn't want them. It's hard. Okay, so let me make sure.
The lighting. Maybe.
Yeah, I don't want to chat. Wait, can you come closer a little bit? Okay, there we go. All right, we got our guy. Okay, so go ahead, Alex. Introduce yourself. Tell me what your position is here at the center.
Hi, Ali. Thank you for joining us. My name is Alex Bejarano. I'm the Director of Public Relations for the Regional Center for Border Health and the San Luis Walk-in Clinic. We're a 501c3 nonprofit charitable organization serving Yuma, La Paz, and Mojave counties.
So are you guys seeing any kind of irregular numbers? I know we had 4,000 people over a really busy weekend with MPP being reinstated. So did you guys have kind of an influx of people as well? Were you able to handle helping additional people that were coming in, or what did your last couple days look like?
They've kind of remained steady.
Okay.
We accept people as fast as Border Patrol can process them. So, if they only process 30, then we only take 30. Today they processed 160 between Border Patrol and ICE, so that's how many we took today, and that's equivalent to 3 buses.
Okay.
So one bus holds about 54 people, and we have 4 charter buses on standby, ready to help us with these people today. We do kind of a survey amongst the refugees, asylum seekers. We do a survey if they're ready and have sponsors and family ready to buy them their plane ticket, then we'll send them directly to Phoenix Sky Harbor International Airport. If they're not ready to travel, they don't have the means or they don't have the money to purchase their ticket today, and maybe they can tomorrow, then we have agreements with shelters, one in Riverside County, California, which we work really close with, and we'll send a bus there today with the group that doesn't have the means to travel today and that need just one extra day to regroup and get their situation in order.
Alex, thank you for that insight. We haven't really been able to understand the process a lot because there has been a point of contention with NGOs. But tell me what you guys are doing. You're helping these people, as
Absolutely.
I've explained to people, that this isn't a situation where you are trying to enable illegal activity, but you're trying to be human in this situation. So explain a little bit about that.
Absolutely, Ali. This is a humanitarian crisis, and we're helping in a humanitarian way. What we do once processing has been complete at Border Patrol, their biometrics, their background checks, all that kind of stuff that the officials at ICE and Border Patrol do, then they release them to us. And we started this number one because it was a humanitarian crisis and we were in the middle of a pandemic. And so in an effort to help mitigate the spread of COVID-19, we didn't know, these people are coming from foreign countries. We don't know what virus they're carrying, if they're carrying COVID or just the common flu or whatever.
Dengue or tuberculosis. We've seen that. It's scary.
But we wanted to help protect our community because we'd worked so hard as a healthcare agency. We're the leading nonprofit in Yuma County, in Yuma, La Paz, and Mojave counties doing testing. To date, we've tested over 160,000 people in Yuma County, that of the total amount of people that have been tested. And to date, we've vaccinated over 60,000 people. So we have taken the lead on anything COVID related in Yuma County. And so when Border Patrol started releasing these people on the streets of Yuma, we thought, wow, we can't let that happen. Number one, Yuma doesn't have the infrastructure to support those kind of releases. We don't have shelters. We don't have a major airport. We don't have a major bus station. So these people were just kind of left to their own devices. And so we said, let us help. And we worked it out with Border Patrol, and that's where we stepped in. So now what happens is Border Patrol, instead of releasing them onto the streets, which nobody wants, because there's, like I said, there's no infrastructure for them to travel. So Border Patrol releases them to us. We test them for COVID-19 with a rapid test. And of course we can't force them. It's all voluntary, but 99.9% of them agree to get tested. And we test them for COVID. If they're positive, then we ask them to quarantine. And about 99.9% of them agree to quarantine with us. We go and test them every day. And once they're negative and safe to travel, then and of course we provide any medical care they might need while they're here. And once they're negative and able to travel, then we help them, we load them back onto our charter buses and get them on their way to see their families or their sponsors wherever they're going.
So what about the vaccine side of things? Are we vaccinating people here, or what are we doing?
A lot of them, we do have vaccines available. For refugees, we've been wanting to just use Johnson & Johnson because it's a single dose and we don't know if they're going to have access to the vaccines wherever they're going. So if we do have Johnson & Johnson's, we do offer it to them. Some of them take it. Some of them have already been vaccinated with the Oxford AstraZeneca on the Mexican side, or the CanSino, or the Sputnik. And so we, at that point, we don't want to mix any of the vaccines until they get to where they're going and they can see their doctors or whatever county health officials in that area.
Okay. Now I know you see this question coming, and it shouldn't be a tough one, but it's one that everybody is always going to wonder: is where are you guys getting the funding? Are you using any government funding to this? I know you are an NGO, but I know there are funds available through different acts and different things. Excuse me. Is there any government funding being used to help in this operation?
Right now, everything that we've done, and since the end of, I believe, the end of February, we've paid for out of the agency's pocket. We would like to get reimbursed, and we are working with FEMA to see if they can provide some reimbursement. We know that the reimbursement won't be 100%, so we are going to most likely take a loss. But again, this is a public service that we're providing for our community in an effort to avoid the spread of COVID and in an effort to stop the releases of asylum seekers into the streets of Yuma, because again, Yuma does not have the infrastructure to support those kind of releases.
Right. You guys are doing what seems like an impossible task. It's a really tough job that you guys, like you said, you're up against a lot of critics. And so with that said, you're talking about when the families are ready to see them, when they're ready to receive them. I've talked to some people who don't have people on the other side, in the States.
Yeah.
And with the migrant caravan I was walking with, some people don't have sponsors. And I've even had people have my card reaching out and asking if I can help them find somebody. So what does that look like? How are we finding sponsors? Are we paying people? Is the government finding sponsors? Like, how do we find these people out of thin air to send these folks to? I guess if they don't have a family member.
We haven't run into that problem. The majority, thank God, the majority of the people that we get, in fact, all of the people that we get have either a family or a close friend that they're going to, and that's all listed on the paperwork that immigration releases to them. It says basically you're not a legal resident, but you are given this A number and this court date and this address where your family lives, and that's where you need to be until your court date. Mm-hmm. So we haven't run into that problem.
Okay. So I mean, I know that you have absolutely been hammered with negative things. It is a tough situation for you guys. So what do you feel? You've been doing this job. You guys started this because of the pandemic with the intention of keeping the community here safe, not necessarily to enable a situation, but people, say that these NGOs are complicit in human trafficking. How does that make you feel when you're standing out here telling me like you're doing a service for your community?
I think that the Yuma community is grateful for the work that we're doing, and I think that they know, and if not, I'd like to tell them that, obviously we are not complicit in human trafficking. We are working with Border Patrol officials. I mean, these people have been processed, their biometrics have been done, their background screenings have been done, and these people are the ones that are deemed okay to come out into the community and wait for their court date. So the Border Patrol and ICE is following a legal process, and that's just the law of the United States. Mm-hmm. And so they're following the legal process right now, regardless of how these people got here. That's what they have to do, and we are in this. We have a really close working relationship with the Yuma Border Patrol and the ICE officials, and we're doing this to help them out because they're overwhelmed in their facilities, and they don't have room to house all of these people coming across. And whether people think that it's good or bad, the bottom line is it's happening, and so something needs to be done, and we're happy to be in a position and to work for a strong agency that's able to support this type of operation at this point in time.
So do you guys, and I know this is a sensitive question, do you deal with unaccompanied minors? Do you have those in your pathway? Is that something, because I know that once unaccompanied minors basically go into border custody, we kind of don't see them mm-hmm. again on our side. Yeah. Is that something you are seeing? Do you guys take care of the unaccompanied minors, or can you tell me anything about that?
As far as we know, no, we don't get any unaccompanied minors. We only get either single male or female adults or family units from Border Patrol. Okay. As I understand it, the unaccompanied minors are turned over to the Department of Health and Human Services at the national level, and then they deal with getting them reunited with their families, but we have nothing to do with unaccompanied minors.
Okay, is there anything else you want people to know about your operations, what you guys are doing, what your issues or mission is here in Yuma?
Sure. I mean, the Regional Center for Border Health and its subsidiary, the San Luis Walk-in Clinic, we've been committed to improving the quality and access of healthcare along the U.S.-Mexico border for the past 30 years. We have operations in Yuma, La Paz, and Mojave counties in Arizona, and we are just a healthcare agency. But above all, I like people to know that we're a public service agency, and if we can't do it, we know we can refer you to anybody that can. So we want our patients to be healthy and happy, and to be productive members of our Yuma society, and we're real proud of everything that under the leadership of our CEO Amanda Aguirre, we're really proud of everything that we've been able to accomplish, and I think that's about it.
Now, Alex, with what do you guys help regular's not the word, but do you help Yuma residents, like citizens here, or is it mostly migrants? What is?
No, our clinics are open to everybody, and the migrant situation is very new to us.
Has it impeded on your ability to help your citizens here at all?
No, not at all. Our clinics are 100% fully operational. In fact, we just during the pandemic, we opened a 64,000 square foot facility in San Luis in partnership with USDA Rural Development, and it has a outpatient surgery center, primary care, all of our clinics, and we have 4 medical mobile units that can be deployed to anywhere, are fully licensed and fully 100% combined with between behavioral health and primary care.
Wow. Okay. Now, my final question would be, with these folks that are here right now, when you guys are going to process them, I'm trying to figure out how to ask this in a way that's not going to be offensive. Are you guys providing them with any funds or any way to get to their next destination if they don't have the means themselves?
No, we're not. Okay. If we have in the past, just in extreme situations.
What would an extreme situation be? Walk me through that.
So someone that's like in a wheelchair, or that's someone that is released from the hospital to us, and that, for example, someone needed a portable oxygen machine that the hospital purchased for them, then we help them in those cases. But for the most part, people that don't have the means to travel, as I mentioned earlier, they go to a shelter, and then the shelters help them get to their final destination.
Okay, wonderful. Okay, Alex, thank you so much.
Thank you.
Really appreciate it. Let me give you a card.
Yeah, absolutely.
So that we can stay in touch here, and if you guys need anything, or if you have any crazy thing happen, reach out to me. I'm your girl. We'll live stream and not take anything out of context, okay?
Sounds good. Thank you,
Take care of you. Thanks for what you're doing. Be careful. And I did park right over there, so I'm going to walk that way and head out. Okay, Alex? Thanks.
Okay, guys, so we just finished up talking with the public relations manager here about their situation at the NGO. So again, you heard him talking about the charter buses. They had 160 people come from Border Patrol this morning, today. That's what they've got, and that's what they're dealing with. They said people that don't have the means to travel today, they will go on a charter bus to Riverside, California. You heard him talking about that. So really interesting information, because here's the thing. NGOs have gotten a lot of really bad publicity, right, lately. So he even said that they don't talk to the media. And I explained, you guys heard at the very beginning, you wanted me to cut my feet and everything, and I just explained what I'm doing, and that's the beauty of being honest. People will talk to you. What a concept. So I told him I'm going to leave, so I'm going to pop off my live so I can drive, because I don't break the rules. So yeah, it is really interesting to hear from him. Wow, I gotta digest that. I'm gonna pop on again in a little bit, but I'm heading out now, so we'll check back in just a little bit. Thanks, guys.